Hey guys, it's FIlipina here. Welcome back to my channel. If you are new here, please do not forget to like, subscribe, leave a comment down below. And in today's video, I'm going to be giving you my 10 tips for drawing blood. Also, stay tuned towards the end to see some bloopers of the video as well, if you want to get a little laugh out of it. And if you'd like to see what happens next, then keep on watching. First and foremost, why do doctors draw your blood? There are various reasons why doctors order blood tests. One of the main ones is to see your overall health for your blood levels. If you have a condition like mine, my thyroid condition, they have to see me every 6 months to make sure that my medicine is keeping me leveled. And drug levels, like if they're going to prescribe you narcotics, they need to make sure that it is in your system, because some patients like to sell their medicine. So if it's not in the system or it's not been leveled how it has been, then they'll know that you haven't taken the medication. And they also test for like certain diseases also. One of the most important tips of drawing blood is to make sure to use the correct color tube for the test that's being ordered. Because, for example, the CBC test or complete blood count, they use the lavender top tube. So I'm going to insert a picture of that. Each facility uses their own order of draw or test tubes, so it's best to familiarize with what your facility uses. What is the most common site for blood draws? Usually is the antecubital fossa, which is right here in the bend of your elbow, right here. And I'm going to insert an image of the veins that they most commonly use also. Most common is the median cubital and also the cephalic vein. The basilic vein is more of the third choice or the last resort. They don't try to use that one, but if you can't get the first two, then they use that one. The reason why it's the last resort is because it's so close to your nerves. So we try not to use that one. So on with the tips. Tip number 1, feel, do not see. Try to feel the vein instead of trying to look for it, because a lot of patients don't have very visible veins, so it's best to try to feel for it and use your index and your middle finger to try to feel for it. Oh my eyes. Okay guys, I'm going to move you to my room now. Okay guys, so as you can see, I had to move rooms, but if you can hear my husband snoring, I'm so sorry. I'm gonna play some music in the background of this, so hopefully it drowns it out. But anyway, back to what I was saying. It's best to feel for a vein instead of look for it. It should feel bouncy and like springy. Tip number 2. Rolling veins. If you have rolling veins, it's probably best to get blood from your hand, like the top part of your hand, because it's more sensitive, and you need to use a butterfly needle, which is the really small ones that has the little wings on it, and they're real skinny, like that big. That big. They're really little. Those are also used for patients that have fragile veins, like the elderly, or just have smaller veins that are harder to get with a big needle. Sorry, the hub. If you use that, it might suction too much blood, and you could collapse the vein. Tip number 3: do not leave the tourniquet on for more than a minute, because you could cause hemoconcentration, which is what causes the volume of your plasma to decrease, and it can cause inaccurate test results, which means you would have to do another blood draw to get the test results for that patient. Tip number 4, always release the tourniquet before taking out the needle. Because if you take the needle out first instead of the tourniquet, then you could cause what is called a hematoma, otherwise known as a bruise. And those are very painful, so if you wouldn't want that done to you, please do not do that to your patients either. Tip number 5 that I get all the time: do not fish for a vein. That is so painful for a patient. You're also probably injuring other blood vessels, nerves, muscles in that arm, and possibly could rupture an artery. So please do not fish for veins. It's very painful and unprofessional on your part. Tip number 6, please do not re-stick a patient either. So if you miss the vein, it's fine, it's okay. Just remove that needle, have the patient press the gauze on there. Don't bend the elbow, it could cause the bruise. Just have them keep it straight like this and then raise it above their head. Get another needle, redo it again. You can stick that same arm, just use a different vein, or if you cannot get one out of that one, then try the other arm. If you can't get anything out of that one, then go to your supervisor or have somebody else help assist you. Another tip that I've seen other healthcare professionals do, which bugs me, is tip number 7. Do not blow on the site that you cleaned, because all you're doing is just recontaminating the area. The best thing to do, what I've learned in school, is to, while you've cleaned the area, put your equipment together, have everything ready, and just ask the patient, is it dry? When some professionals stick you before it's not dry and it's still wet, it burns. And I didn't know that until I went to school, and I didn't understand why it burned when some people stuck me. And that is why, because they didn't take the time to allow the alcohol or the chloroprep or whatever they use to clean your arm with to dry. Tip number 8, make sure when you cleanse the site, like let's pretend this is the bend of my elbow. When you clean the site, make sure to get the alcohol wipe and clean from the center outward instead of up and down like that. Because when you do it outward and going from here and then just out, when you're cleaning like this, you're just recontaminating that area, putting wet bacteria that was already on there, just smearing it. So it's best to start from the center and moving outward. Tip number 9, you can ask the patient to dangle their arm, pump their fist some before you do the stick. While they're dangling their arm, you can apply a warm compress, which helps because when they dangle their arm, gravity helps pull the blood. A warm compress helps bring blood to the surface, so that way it'd be easier to find the vein also. And tip number 10, the one thing that actually happened to me when I was in school, but it actually had happened to me when I was a patient years ago, but now learned that it's not supposed to be done. So tip number 10, do not slap your patient's arm doing this to get the blood to come up in that area. The reason why is because now, if you do that, it is grounds for a lawsuit. You can be sued for battery. Yes, that is considered battery. So, the next time you just cannot find a vein, either have them dangle their arm, pump their fist to get the circulation going, or to put a warm compress on there. That is all for you guys. I hope you liked today's video. Please leave a like, comment, subscribe, and leave your video suggestions down below in the comment section as well. I will see you guys next time. Bye. leave a comment down below in the section. And if you like people, I can't talk. Or your blood. There are blood draws.